There's a lot of cells.
I love being able to help people. I love being able to think about how can we do better for cancer treatment? What is the next steps? We've come a long way in breast cancer treatment and in cancer treatment broadly, but there's so much more that we can do and we need to do for the future.
And some of those wells.
In 2016, we received a grant from Untitled Chapter to look at some gene changes in breast cancer cells. As cancers develop, they start picking up mutations, and that causes the cells to change from a normal cell of the body to a cancer cell. We were interested in one of those gene mutations for which drugs are available. And these are tailored, targeted drugs that work specifically on that gene and will not have the side effects of chemotherapy. That was part of a big research effort and led to a clinical trial that the Siteman Cancer Center led.
My particular interest in research is to develop targeted therapy so that we can individualize patient treatment, in patients with breast cancer. We enrolled 16 patients. 30% of those patients, 5 of them were able to, we call clinical benefit. So their tumor either shrink or they were stable for over 6 months. And these were just with a single drug, neratinib, which is a pill, not chemotherapy. We want more patients to be able to respond rather than 30%. So that's when we started to think about combination strategies. And one of the candidates would be adding on estrogen receptor targeting.
The initial grant from Petal the Cause was really key in this research. It helped us get this project off the ground, advance it to the next step. When we applied for a federal grant, it was highly competitive. There was about 100 other applicants, and they only chose one grant for funding at this level. We were that grant. Everything worked out, and the Petal the Cause enabled us to do that.
Without Petal the Cause, I don't think we would have been able to make these progress and able to get the funding from DoD.
This research has spawned 3 or 4 clinical trials internationally to look at this gene change in breast cancer.
After people know that we have this trial, we were approached by many academic institutions. So eventually it became a 14-center trial, including Dana-Farber and Mayo Clinic and Baylor College of Medicine. So we did not solicit their participation. They just, they're really excited about the trial.
This is the tip of the iceberg. It's going after cancer in a precision oncology setting, trying to figure out what are the things driving the cancer cell and try to knock them out.
I think it's really very inspiring with all the people participating. That helps me to kind of a positive reinforcement that I need to continue to do this.
It's a fabulous event. A lot of times people are working away in the lab. They don't realize the broad impact of what we do. And I encourage people from my lab to come out and see. These are people's lives that you're touching. And to see everyone here today is just incredible. This jersey is a great source of pride for me. I wear it proudly. I'm glad to be part of Siteman Cancer Center. I'm glad to be a researcher here. I'm glad to be a doctor here. And I'm glad to be standing with you here as we fight cancer.